All right, let's talk about something really important. If you're over 60, the world of vaccines can feel, well, a little confusing, right? Today, we're going to clear all of that up. And trust me, this is about way more than just dodging a cold. We're talking about choices you make now that could literally safeguard your independence for years down the road.
I mean, really think about that for a second. It sounds dramatic, doesn't it? But it's true. So many of the small, almost unnoticeable health choices we make every day, they're the ones that quietly build the life we get to live tomorrow. And it turns out, one of those decisions might just be more critical than you ever imagined.
So here's the deal. As we get older, our immune system, our body's personal security team, it just doesn't work quite as fast as it used to. An infection that you might have shrugged off at 40 can suddenly become a huge deal at 70. It hits harder, and man, does it take longer to bounce back. That's exactly why we need to be smart about which vaccines are actually right for you, right now. Okay, so first up, let's dive into 3 types of vaccines you might want to rethink. And just to be clear, this is not about being anti-vaccine. Not at all. It's about being pro-smart vaccine, choosing the right tools for the job at this specific stage in your life. So we're going to break this down into 3 main areas. First, we'll look at live virus vaccines and why they can be tricky. Then, we'll talk about vaccines that are kind of, well, for the wrong age group. And finally, we'll cover the surprisingly common issue of repeating vaccines you really don't need to. So what even is a live virus vaccine? It's actually a pretty cool idea. Think of it like this. Scientists take the actual virus, weaken it in the lab until it's just a shadow of its former self, and then introduce it to your body. It's like giving your immune system a safe sparring partner to practice on, so it knows how to handle the real fight if it ever shows up. And for a strong, healthy immune system, it works like a charm.
But, and this is a big but, here's where things get complicated. A healthy immune system? It easily pins that weakened virus to the mat. No problem. But what if your immune system is already a bit tired, a bit compromised? Well, it might actually struggle, and that weakened sparring partner could cause some real trouble, sometimes even causing symptoms similar to the very disease you're trying to prevent. And having a weakened immune system isn't some rare thing. It can be caused by a lot of common situations. We're talking about things like steroid use for arthritis, medications for autoimmune issues like lupus, or going through cancer treatments. Even things like advanced kidney disease or complicated diabetes can play a role. So, if anything on this list sounds familiar, it is absolutely crucial to have a chat with your doctor before getting any kind of live vaccine. Okay, on to our second point. You know that feeling of better safe than sorry? Sometimes we think, hey, there's a vaccine for that. I should probably get it. And that impulse comes from a great place. But when it comes to vaccines, more isn't automatically better. There's a really good reason why recommendations are so specific about age. Take the HPV vaccine, for instance. Super important, but its main job is done in younger folks, before they're exposed. Or think about some of the meningococcal vaccines. They're often aimed at college students, packed into dorm rooms, which is a totally different risk environment than, say, someone enjoying their retirement. It's all about making sure the protection fits your actual life, not just getting a shot for the sake of it. This really gets to the heart of our third point. We spend so much energy worrying about missing a vaccine that we forget to think about the flip side. What happens when we get one too many times or too soon? Let's look at a couple of big ones: the pneumonia shot and the shingle shot. For these, the schedule is everything. If you get them again too soon, you're not getting extra protection. Nope. What you are likely to get is a much stronger reaction, more swelling, more fever, just feeling crummy. Your body doesn't need a second dose it's not ready for. Even the flu shot has an annual schedule for a reason. So it's not about more, it's about being smarter. All right, enough of what not to do. Let's flip the script and talk about the absolute must-haves. These are the big 3, the vaccines that are like a superpower for protecting your health, your freedom, and your future. I want you to just look at this number: 1 in 3. That's not a statistic from some faraway place. That's the odds that any one of us Americans will get shingles. And as we get older, that risk just climbs and climbs. So no, this is not some rare, obscure disease. It is a very real and very common threat. Have you ever heard someone say this? If you know anyone who's gone through shingles, I bet you have. Because it's so much more than just a skin rash. People describe a pain that is just relentless. It gets in the way of everything: your sleep, your comfort, your ability to just live your day.
And this is the thing everyone is terrified of. It's called postherpetic neuralgia. And what it means, in simple terms, is that even after the rash is long gone, the pain stays. We're talking about a burning, stabbing, electric shock kind of nerve pain that can stick around for months or even years. It's awful. And this is exactly what the Shingrix vaccine is so incredibly good at, over 90% effective at stopping before it can even start.
Okay, let's move on to the second powerhouse vaccine. We're talking about pneumonia. So many of us just think of it as a really bad chest cold, but for folks over 65, it's a total game changer. It is one of the top reasons older adults land in the hospital, and believe me, climbing back from it is a long uphill battle.
And here's what you really have to get. Pneumonia is not just a lung problem. It's more like the first domino to fall. It puts immense stress on your body, which can increase your risk of a heart attack or a stroke. Plus, just being in a hospital bed for a week can cause you to lose muscle mass, making you weaker and unsteady on your feet. It's a whole cascade of bad news. The pneumococcal vaccine isn't just a shot for your lungs. It's a shot to keep all those other dominoes from falling. And finally, number 3, the good old annual flu shot. But wait, here's a pro tip that a lot of people miss. Not all flu shots are created equal. If you're over 65, you shouldn't just be getting the standard shot. You should be asking for the high dose or a judgmented version. Why? Well, think of it like this. They're specially formulated to give your immune system an extra nudge, to wake it up and get a much stronger, more protective response. It's the flu shot, but supercharged for you. So there you have it, the ones to question and the ones to get. But information is only powerful if you use it, right? So how do we make this happen? This is where you go from just being a patient to being the boss, the CEO of your own health. And honestly, it's not complicated. First, get a little notebook or a folder and keep your own vaccine record. Don't rely on your memory or some dusty file somewhere. Second, talk to your doctor. Be totally open about what's going on with your health. And third, and this is so important, ask questions. Don't ever feel shy about asking why or what about. It's your body, and your health is absolutely worth that extra minute of conversation. Because at the end of the day, this isn't really about needles and pharmacies. It's about your future. It's about being able to walk around the block with confidence a year from now. It's about being able to pack a bag and travel 3 years from now. It's about staying independent in your own home, living life your way 5 years from now. That's the real prize. So that's the question I want to leave you with. Think about the you 5 years from today. Will that person look back and thank you for taking a few simple, proactive steps today? Because I guarantee you, the choices you make this year are the foundation they'll be standing on. You're not just getting a shot, you're investing in your own strength, your own freedom, and your own future.